handling has been identified as the main cause of food contamination in Kenya.
The germs which are found in food are normally of viral origin, which is the rotavirus. We have the parasites, and then we have the bacteria.
Throughout the day, food handlers handle money, touch people, surfaces, and objects. This causes them to accumulate germs on their hands, which in turn can infect themselves and others. Upholding proper hygiene practices is the first line of defense against foodborne diseases.
We indeed have carriers, people who carry these germs. The carriers, they carry these germs, and these germs don't affect them, but they can transfer them.
Eating contaminated foods can lead to diarrhea, fever, abdominal cramping, headache, and nausea. Although food poisoning can be serious, it is usually resolved in a few days. The Food, Drugs, and Chemical Substances Act was developed by the Ministry of Health to implement standard regulations that ensure that food handlers, particularly those in hotels and restaurants, uphold safety and hygiene guidelines.
We all need food. Our body needs food. But at the same time, this food can be very poisonous if not properly monitored.
The regulation and supervision of food safety is determined by medically screening food handlers every 6 months. This service is provided through Kenya Medical Research Institute.
Every time we do the test, after 6 months, we find, say in a hotel, if there were 5 people with amoeba this time around, the next time we test there will be none, because also we treat them.
In order to avoid food contamination, food handlers should strictly follow proper hygiene procedures like wash your hands frequently, including under your nails. Wash cutting boards and counter surfaces thoroughly, particularly after handling uncooked foods. Wash fruits and vegetables thoroughly before eating. Bathe daily and keep any cuts clean and well covered. Frequent hand washing is one of the most recommended ways to limit the transfer of bacteria, viruses, and other microbes. Although it's impossible to keep your hands germ-free, washing your hands often will help you avoid getting sick and spreading illnesses. Always wash your hands before preparing food, eating, treating wounds or giving medicine, touching a sick or injured person, inserting or removing contact lenses. Always wash your hands after preparing food, especially raw meat or poultry, using the toilet, changing a diaper, blowing your nose, coughing or sneezing into your hands, treating wounds, handling money, touching a sick or injured person, handling waste or garbage. Hand washing requires only soap and water or an alcohol-based hand sanitizer. Proper hygiene guidelines for food preparation should not only apply to those working in the food industry, but should be adopted in all households. Georgette, Citizen TV, Nairobi.